Hello guys, so we have discussed the vaccination dosages and what all vaccines you give in case of children, in case of adolescents, right? For children we have discussed the age group between 0 to 6 years. For adolescents we have discussed the age group between 7 to 18 years, and now more than 18 years it would be the adults. Okay, so we shall be discussing the vaccinations, what all vaccinations you give and what are the dosages which you give in adults more than 18 years. Okay, so let us start on with the topic now. The topic of discussion will be adults right now. Vaccination in adults, that is more than 18 years. More than 18 years. Okay. Now, when it comes to more than 18 years in adults, actually there are few vaccines to remember. So, remember like this: ZIVT. Okay, remember it like Zincovit, the multivitamin syrup or whatever it is, ZIVT. Now, what does this Z stand for? Z stands for zoster virus. That is the zoster vaccine, right? Z stands for the zoster vaccine. And what does I stand for? I stands for influenza, all of you know. Influenza. And V stands for varicella. Varicella. And T stands for Tdap vaccine. Tdap vaccine. Now this zoster vaccine, when can you give? How many doses you have to give first of all? So how many doses of zoster, influenza and varicella are? For example, zoster virus, I will give around 2 doses. 2 doses of zoster vaccine. The same with varicella also. Varicella also I give 2 doses. Varicella also I give 2 doses. And influenza, all of you know, 1 dose annually, right? So 1 dose annually. 1 dose annually. Okay. Now, I told you zoster vaccine has to be given in 2 doses. So when do you give 2 doses? So you have to give 2 doses. For example, after 18 years, right? So right now, just now I have attained 18 years. Now I go out and take a zoster dose vaccine. Zoster vaccine. I will take a single dose of zoster vaccine. Right? My age is right now 18 years. I go out and I take a zoster vaccine. After that, I will give a gap of around 2 to 6 months. And then I take the second dose. Okay. So, how much gap should be there? 2 to 6 months apart from the first dose. Okay. That is how I take a zoster vaccine. Now, when it comes to varicella, varicella also the same. So, first 2 doses. For example, I just achieved 18 years and I go out and take zoster as well as varicella vaccine. Okay, but for zoster vaccine I wait 2 to 6 months before I take the second dose. Now when it comes to varicella, I would wait around 4 to 8 weeks. 4 to 8 weeks before I take the second dose. So you need to wait 4 to 8 weeks apart after taking the first dose before taking the second dose. Now when it comes to Tdap, Tdap also immediately once you achieve 18 years, you can take a single dose, and you have taken sufficient amount of Tdap so far right now, right, from your childhood. So what you do is that after taking this single dose, now you start taking booster dose. Okay, now when do you start taking booster dose? You start taking booster dose every 10 years, and then booster dose every 10 years. Booster dose every 10 years. Okay, so this is all the vaccinations which you have to discuss, guys. Okay, and let me also tell you one very important thing regarding the pneumococcal vaccine. There is a vaccine by name pneumococcal PPSV23 vaccine. Okay, now When to take this pneumococcal vaccine? This pneumococcal vaccine has to be taken after taking PCV13 vaccine, pneumococcal conjugate vaccine. We have already discussed about PCV. I hope you remember it, right? So that the complete name is PCV13. Okay, pneumococcal conjugate vaccine, pneumococcal conjugate vaccine. So when do you take pneumococcal conjugate vaccine? In the second month you take the first dose. In the fourth month you take the second dose. In the sixth month you take the third dose, right? So in the second month, in the fourth month, as well as in the sixth month. Okay, so in the second month, which dose do you take? You take the first dose. In the fourth month, you take the second dose. Now, in the sixth month, you take the third dose. After taking these doses, at least you need to wait 1 year before taking pneumococcal PPSV23 vaccine. Okay, so if you want to take PPSV23 pneumococcal vaccine, first you have to take PCV13 and wait 1 year and then take that pneumococcal this PPSV23 toxin. Now an important thing is that in which cases this vaccine is indicated. What are the indications of this vaccine? Now what are the indications of this vaccine are? First indication is the age should be somewhere between 19 to 64 years with the following problems, with the following conditions. So you need to have this list of conditions which I am writing below. So only under those conditions, and your age also has to be 19 to 64. So from age 19 to 64, in between this age, if you get these conditions, then definitely you need to be vaccinated with PPSV23. Now what are the conditions over here? What are the conditions are simple things. You have got your heart, so that would be chronic heart disease. Chronic heart disease. What all organs you have, guys? Yeah, you have got your heart over here. You even have got lungs. Right? And you even have got your liver. And after that, what all organs you have? Yes, you have got your kidneys over here. So these are the main organs. So chronic heart disease. When it comes to lungs, chronic lung disease, and after that you have got your liver, chronic liver disease, and you have got your kidneys, chronic renal failure, right? And let us say after that you have got diabetes mellitus or HIV infection. So in these cases, and also few simple cases are there like cochlear implants, CSF leak and all. So let us also make a note of that. For example, cochlear implants as well as cerebrospinal fluid leak. So in these cases, these are the conditions, these are the indications for taking your pneumococcal PPSV23 vaccine. Okay. For example, let us say there is a blunt trauma to the left hypochondric region. So this is the left hypochondric region. Now when there is a blunt trauma to the left hypochondric region, you have got your spleen there. So obviously there will be rupture of the spleen. So in that condition you cannot suture the spleen, rather you need to remove the spleen. So obviously patient will undergo Splenectomy. Patient would undergo what? Patient would undergo splenectomy. Okay. Now, whenever a spleen is gone, you know what kind of infections you are at a risk? You know, when spleen is gone, you know what kind of infections will most commonly infect you? So, those infections of encapsulated organisms. Encapsulated organisms will infect you. What are these encapsulated organisms? For example, when splenectomy has happened, you will be affected with Streptococcus pneumoniae. Okay, you can be affected with Haemophilus influenzae. And Neisseria meningitis. Okay, so you are at a higher risk of getting infections from these three organisms. So for that reason, those patients who have undergone splenectomy definitely have to receive three different types of vaccines. And what are those three different types of vaccines? One is that patient has to receive PCV13 pneumococcal conjugate vaccine to prevent Streptococcus pneumoniae. One should also receive Haemophilus influenza type B vaccine. Okay, one should also receive meningococcal vaccine. Meningococcus vaccine. So these are some of the important things. Okay, so these are some of the important things which one definitely has to know regarding the study of vaccinations, right? So thank you so much for watching my video. Goodbye.